We've seen a tremendous uptick in the last couple of weeks, people calling in with questions about the symptoms that they're having.
Doctors' offices very busy as state health officials say the Omicron variant is surging through Nevada. Before you know it, more people are infected.
So the typical type of flu we're used to, one person on average infects about 4 people. With the Omicron variant of COVID, one person can infect like 20 people.
Dr. Linda Johnson and P3 Medical Group have been seeing an uptick in patients and demand for people requesting an in-office test. She and others advise patients, don't dismiss what sniffles you have as the common cold and still go about your day.
So very difficult to tell the difference. But lots of folks aren't having much of a fever with this. Nasal congestion's been a lot more severe.
Dr. Johnson says, fortunately, the symptoms have been much milder with Omicron, but that doesn't mean you should take it any less seriously. And despite the challenges, do everything possible to get a test.
It's COVID until proven otherwise if you have symptoms, because it's so important to isolate yourself as quick as you can, because otherwise you're going to be part of helping spread it. We want to know if they're COVID positive, because again, we need to quarantine for longer and keep them away from vulnerable folks, particularly in their family.
Dr. Johnson also says fewer patients with the booster have had a breakthrough case, so it's important to get the booster.